Namaste, I am Dr. Vishal Rao, and at the outset I would like to thank Indian Cancer Society for taking these efforts to raise awareness about the aspects of laryngeal cancer or what we call throat cancer for a common man. Today if you see in India, nearly thousands of patients each year are diagnosed with throat cancer, area of the vocal cords. Now, this area is a very interesting area. What we call the windpipe, the voice box, or the food pipe are all intricately connected to each other. Think of it that when I swallow, I cannot speak, and when I speak, I cannot swallow. This is a normal thing. Try doing it. You will realize that both of them work so much in close that when I speak, at that time I can't swallow because my vocal cords are open, and that's why any food falling inside will fall into the lungs. That's why I am not able to eat when I speak. Similarly, when I am eating, I can't talk. The voice box and the food pipe. So both these areas are vulnerable for cancer, and 90 to 95% of these cancers are tobacco related. What we see in rural areas and semi-urban areas is chewing tobacco is very prevalent, and the juices of these chewing tobacco go into the food pipe. So we see more amount of food pipe cancers in people who use chewing tobacco, and in people who smoke BDs and cigarettes we see more of the vocal cord or voice box cancers, both again together called as the throat cancer. They lead to spread of the tumor from there to the lymph nodes. It's like I would say that if my house is in the vocal cord, from the side road I go to the main road, which is the lymph nodes. These lymph nodes are immune cells which actually prevent the cancer cell from spreading into the other parts of the body. But unfortunately, the cancer cell can break these immune cells and enter into the blood and then try to spread into the lungs and elsewhere. That's when we call it stage 4C. Now, typically when it is in early stage of these cancers, that is stage 1 or stage 2 are called early stage. Stage 1 and stage 2 lead to attempts for what we call non-surgical, we can still save the organ. Now when I say save the organ, if it is a voice box it should be able to talk, if it is a food pipe he should be able to eat. However, in stage 3 and 4, sometimes it becomes more difficult to save the organ because the organ by that time is destroyed. It is not able to do its breathing, it's not able to do its speaking, it's not able to do its swallow functions. So all of these reasons, we know that the voice box is very important. Now when the voice box becomes dysfunctional and it can't do this, that means the patient either has a hole in the throat because of which he can't breathe, he has a terrible hoarse voice and he's coughing all the time, inability to swallow. These are signs of saying that the cancer is progressing towards a larger advanced stage 3 or 4, in which cases you may require to remove the voice box. So just to sum it up, stage 1 and 2 are early cancers of the food pipe or voice box, we save it. We try to keep it functional. In stage 3 and 4, advanced stages, we have surgery followed by radiotherapy or chemotherapy. What is the point of saving a voice box which doesn't work? Or a food pipe that is not able to swallow? When I said even if it's a food pipe cancer, because it is stuck to the voice box, you will have to remove the voice box even when you remove the food pipe cancer. This leads to a permanent loss of voice, and that is quite crippling for a cancer patient. In addition to this, the patient has a new nose. Now our regular nose does the work of breathing, filtering the air, cleaning the air, warming the air and humidifying the air. This part of the nose, which is the new nose, cannot do, and that's why these patients wear a small cloth over here which is kept wet so that they can breathe and thus prevent the lung from having more infection. But speech is lost in this bargain, and that is a procedure called laryngectomy. Namaste.